Hello everyone, welcome to Vessels Club Podcast, a platform where we have honest conversations about our faith, our growth, our purpose, and social life issues that happen every day. My name is Deborah Asumde Nyamiche, and I'll be your host for today. So, on today's episode, we'll be discussing addiction. What exactly is addiction? What causes it? How does it affect we the young people, and what can be done to overcome it? But before we get into the discussion, don't forget to subscribe to our channel. We have here Mrs. Mary Forson, a nurse specialist in addiction, a wife and a mother of 4 beautiful children, here to discuss the topic of addiction with us. Let's get into it. Okay, Mrs. Forson, please welcome to our podcast today.
Thank you very much.
Please, I hope you are doing well.
Yes, I'm very well.
Okay. So today our topic on discussion is addiction. We want to understand what exactly is addiction, because there are a lot of things or a lot of theories, a lot of explanations people give to addiction. So we want to take it from the medical perspective and as a psychologist too, what you would say.
Okay. So greetings to my viewers and my listeners. To everyone watching, say hi to you.
Hi.
Okay, so addiction. So there are so many misconceptions about what addiction really is.
Okay.
And I got interested in this kind of program.
Okay.
And that's what informed my acquiring more education and knowledge on this very topic. When we say addiction, so picture someone who takes alcohol every time.
Okay.
His money is almost finished.
Okay.
He has lost his job because of alcohol.
Okay.
And family, his wife and children have packed their things and left, and he's still drinking.
Okay.
So in short, we are saying that addiction is a chronic brain disease. And then it's characterized by compulsively seeking substance and using it despite harmful consequences. So when we break the definition, that's where we get our management. Yes, so you are saying something is chronic. It's a brain disease. And then there's compulsion to use it despite harmful consequences. So any chronic disease, just like hypertension and diabetes, has to be managed like addiction. And then because it's a brain disease, we are seeing that there are marked changes in the brain of the person who is an addict compared to a normal person. So we can't compare the two and just say, don't you think you are destroying your life? Just stop. The person cannot stop. You can't stop. Yes, you can't stop. Yes. And so that is what addiction is. But we have behavioral addictions, and then we have the substance addictions.
Okay.
So when we say something is behavioral, so we talk about the pornography, masturbation, gambling, and all that. Maybe eating so much sweets and all that. That can be a form of behavioral. And then we have this other bit as substance. So substance use, we have this marijuana use or cannabis. So marijuana and cannabis are the same. And then we have nicotine, which is mostly cigarettes, cigars, yes, being used. And we have others like ecstasies, tramadol, the opioids. Yes, tramadol is an opioid. And then we have many of them. Yes, many of them.
I normally used to have some issues. I remember growing up, I used to take tramadol. So does it mean I practice substance abuse? Because I was taking it for the pain. But I didn't know it's an opioid right now. So was I addicted to it?
So the thing is that tramadol is actually prescribed at the hospital.
Okay.
And so we have dosages of tramadol.
Okay.
We have 25 milligram, 50 milligram, 75 milligram, 100 milligram.
Okay.
That is actually prescribed by the doctor.
Okay. So those are normal.
Those are normal.
Dosages.
Not that they are normal, but they are not prescribed for more than 5 days.
Oh, okay.
So the highest someone can go with tramadol, because it's an opioid, you can easily get addicted to it.
Oh, okay.
And so we don't prescribe it for such a long time.
Okay.
So a substitution can be made when it's a chronic pain, but not when it's actually supposed to be. Yes.
Okay. I took
And
it
then
just
the
for
one, yes.
a day. Or
Yes.
just a day. So.
And the one on the street, which most people call it red, is 120 milligram, 250 milligram, 220 milligram.
Oh, that's high.
So that's high, and that's what makes it addiction. Yes.
Okay. Okay.
That's where the addiction bit starts from, because you are taking in higher doses. Where we have 50 milligram, 25 milligram, you're not taking any of them. You're taking 225 and 250. You're taking 120, and some people can take the whole pill, the whole blister, 10, can swallow it. Yes,
At a go.
at a go.
Wow.
So that's what addiction is now.
But the red doesn't mean the pill is red. Why is it called red?
Yes,
Okay, the pill is red.
the pill is red, and then we have different kind of pills. So 120 comes in a different form.
Oh, okay.
250 comes in a different form. 220 also comes. 225 comes in a different form.
Different forms.
Yes, but 225 and 250 is the red.
Is the red? Okay.
Yes.
Okay. Okay. When does like be a bad habit? When does a bad habit transition to become like an addiction?
Okay.
Because, for instance, like I gave the example of when I was taking the tramadol. So right now you're saying if I take it more than 5 days, that is when it becomes prescribed. Okay.
Yeah.
No, this time it wasn't prescribed. I think I bought it over the counter.
So it's supposed to be. So it's a prescription medication.
Okay.
So it's supposed to be prescribed to you.
Oh, okay.
And when you are taking it, we don't take it more than 5 days.
Okay.
3 days or less.
Nice.
And if it's a chronic pain, something else has to be given. You can't be on tramadol for that long because you are susceptible to addiction.
Okay.
Yeah, because it's an opioid.
Okay.
So there's this opioid substance in the tramadol. That's what make your pain go away faster. Okay, so you asked one question about what makes it a bad habit, and then what makes it addiction.
Addiction,
So there are two different things. So when we say something is a bad habit, you can stop it at will.
Okay.
It's just a behavior you are actually, you made a choice to do it. But for addiction, you don't have a choice.
Becomes part of you.
It's become part of you. And then when you stop, you don't have any withdrawal symptoms when it's a bad habit. But when it's addiction, you actually have withdrawal symptoms. And then when we talk about withdrawal symptoms, it's not just about I can't sleep, I can't, no. Depending on the substance you use, comes with the withdrawal symptoms. So let's say an example, somebody who takes alcohol, who is addicted to alcohol. Okay, we have 4 stages of addiction anyway. So let's say somebody is
Stages of addiction. Wow.
yeah. So somebody is addicted to alcohol.
Okay.
And when this client wants to stop taking alcohol, it comes with so much withdrawal symptoms. Example, sweaty palms, shaky, you are just having tremors. You see the person, when you ask the person to stretch, you see the person shaking. Yes. And then sweating all over. Sometimes they feel like insects are walking over their body. So we call it hallucination.
Oh, okay.
Yes,
They imagine a lot of
hallucinations.
things.
So hallucination is actually a symptom of mental illness. Yes. So when you're hallucinating, it's different from just you feeling it or you having a sensation. It's much more than that. There is nothing there, but you are feeling it and you can't explain it to anybody who hears it.
So when someone starts hallucinating, you should look at the person very well. The person might be
Hallucination, you will see that it's hallucination
okay.
because the person is feeling it. The person is seeing it. The person is having that kind of sensation. You are not having it. And you can't see it. You can't confirm it. And so that one makes it hallucination. Yeah, so let's say this person with alcohol withdrawal comes in that. When you don't help this kind of person in their withdrawal state, they end up
Going back to
yes. So for alcohol, somebody can end up not remembering anything at all.
wow, memory loss.
Because they actually decided to stop taking alcohol. Some also end up having seizures. Yes.
Because I want to stop
taking alcohol.
That's new.
So you can see how it's a whole path. It's a whole path, and you think that somebody will just stop taking alcohol. No. When a person is not able to stop taking the alcohol, you should know that it's an addiction. So when somebody starts talking to people, so when you see someone addicted and you start talking to the person to stop, and the person doesn't stop, you should know that it is on a different level. And so you can't just use words of mouth. No. So there are cravings, there are withdrawal symptoms, and so you should help the person medically and then psychologically too.
But can you see someone looking all appeared very good, like high functioning, and then the person can be an addict?
Yeah, that's why I said that we have 4 stages of addiction.
Okay, you can take us through the 4 stages.
Okay, so when we say somebody, so the first stage of addiction, that person is not really an addict. So that's the recreational stage. The first time you ever, we call it recreational or experimental stage. The first time you ever took something, you didn't plan for it, just went with friends out of curiosity. Okay, what are you guys drinking?
Glass.
Yes, I see that my friends are drinking, so let me just taste them and see.
Okay.
Yeah, so you don't plan it, you just take it, just a sip or something. So that's the first stage. You didn't even plan it to take it. Yeah, so now you move to the second stage. So the second stage, we call it occasional stage. Occasional stage. Now you are doing it occasionally. Let's say the first time you took it, you realized that you were able to give a speech and you're so good at it. Yeah, so you are going to link your boldness to the substance that you took.
Okay.
And so now, anytime there is a speech, you are going to take what? The alcohol.
Substance.
So that it can give you the kind of boldness to speak.
To speak well. Like
yes, so now you are doing it occasionally. So we are saying that now you've moved from the first stage where you experimented or you are using it. Now you have moved to occasional stage. Okay. So now you might start increasing it a little, but it's not actually a thing. Then the next time.
So can you put that side as bad habits? Okay.
Yes, you can say that's bad habits.
The second stage would be like bad habits.
Yeah, like bad habits.
Okay.
Now you have moved to the third stage. Then when you move to the third stage, it has become now a regular thing. So we call it the regular stage.
Okay.
Now you are actually having time for it. So let's say your weekends are booked for what? Fun. Yeah. So let's say your job doesn't want to see you drinking. They don't support any form of addiction in their workplace. But you are saying that from Friday to Sunday, you are free. And so right from Friday evening to Sunday evening, your day is what? Booked.
For the substance.
For the substance. And you are taking it. So you are now increasing the amount. And then we see that there is something wrong with you. But we can't pinpoint what is actually wrong with you. So maybe I've seen you. You used to be welcomed, coming to work early. But now I've seen that early on Monday mornings, you are not in the mood to work. You just come to work late. And so I see changes.
A lot of changes.
So if you're a family man, you've seen that now your money is not, you were actually taking care of your family, but now your money is not as it used to be. You were learning hard or something, but now your grades have started dropping because you are having so much time for this kind of substance.
And it's also taking your money.
It's also taking your money, but it's not so much of a problem.
Okay.
Then you move to the fourth stage.
Okay.
And the fourth stage, that's why we say that now you are using it so much and you don't even care about whatever people say.
Okay.
And so when you get queries at work, you don't even care. Yes, you still want to use a substance.
Okay.
And you are not even linking the query to the substance you are using. So that's the addiction stage.
Okay. So
yes.
When you get to stage 4,
you need admission.
Medical help.
Yeah, you need an admission to actually help you to stop. So first 3 stages, you can just stop with by words of mouth, encouragement and all that. So the fourth stage, now when you want to stop, you're having withdrawal symptoms. Okay. And the withdrawal symptoms are so severe that you can't just overlook. You have to go and use
medical help.
Yes.
Okay. So let's switch a bit to the youth, like my age group. So what would you say are the most common addictions that we the youth face?
So the youth, for 21st century youth, we have so much on our table. The thing is that it's now more available than before.
Wow. I can just go to any pharmacy or any medical.
So we have so many houses that are actually selling cannabis.
That are not medical sellers, authorized sellers.
So cannabis is illegal. The use of cannabis is illegal.
Okay.
Yes, in Ghana. And so they actually, most people are now selling. So you have a lot of plugs. So they call it plugs. So a lot of plugs in various homes now compared to before. At first, when people see you, so let's say 20th century, when people see you smoking, the way people will talk about you, but now it's different.
Open.
Yes. Now there's more availability. Social media everywhere. The need to belong is still there. So the stress in studies and making sure that things go well. So the pressure is so much on the youth now. That's what makes it more difficult now. And when you were youth, so the thing with addiction is that we trace addiction to when you started using. So anybody who would ever be addicted in the future, we mostly ask of when they started using. So this example about cannabis. So most of my clients will tell me that when they smoke cannabis, they're able to sleep so well. The food they eat tastes better when they smoke cannabis.
Wow.
The water they drink actually tastes better when they smoke cannabis. But it's the consequences that we are looking at. So we are looking at somebody who has come to KNUST and level 200. He is so much addicted to cannabis to the point that he will tell you that, do you know that I can't continue my school?
He rather drop the school and then become an addict.
Yes. So examination time, he's so high that he can't even remember to go to the place.
Exam for,
yes.
Okay.
And so he didn't write his exams. Yes.
All the school fees, all the
school fees. And there are so many trails from first year. And so we are saying that the consequences are so much. So are you going to trade the sweet food, the good sleep, or what water you are getting from cannabis to your graduation?
No, the long run affect your future.
Yes, so that is how cannabis behaves. So that's an example of that. And there are many more experiences I'll share maybe in our next meet.
Okay.
Yeah.
Yes, please. So can you give me what are some of the things that can cause people to go into addiction? Because some people will say, oh, I was lonely, I was depressed. Some of the things that can push them into being addicts.
Yeah, so the number one thing that can push someone into addiction is heredity.
Okay.
Yes, or genetics. So we are saying genetics or heredity. So we inherit certain genes from our parents, our grandparents, our forefathers. That makes us successful to what? Addiction. So we are predisposed to addiction.
Great grandmother was an addict. There's a possibility I can be an addict.
Yes. So maybe you carry the genes, but you've not smoked. Okay.
So the moment I smoke.
So that is how most of us are working in this world.
Oh.
Yes. So I always say that most of us are addicts, but you have not smoked that kind of substance, or you've not gotten into contact with an addictive substance.
Okay.
And so we are free until we touch that kind of substance.
So all of us are potential addicts.
So I'm not saying everyone. I'm saying that most people.
Okay.
So if you see anyone addicted to a kind of substance, and then they can't stop, you should start digging up. And that's what research says. And from experience, I see it so well. So there's a question I will ask during our assessments, that you have a history about your parents, your siblings, uncles, aunties, anyone who is addicted in the family. And when you trace, you might find someone. And it's about 90% of my clients will say yes. There's someone in their family that was actually smoking or actually addicted to something. Yes. And so they got into it. It just happened that they had the genes that gets them addicted. Yes. So there is this drug called pethidine that is used in the hospital. So it's an opioid. And it's very addictive, easily addictive. So this colleague of mine went to the hospital. He had surgery, and then they administered that kind of medication. He never got addicted. But there's another person that went to do CS, and she was given this drug. Could you believe that she became addicted to them?
After it was prescribed as medications for her?
Yes. And then what spoiled the whole thing was that she was a medical personnel, and so she knew the drug that was being given to her. Some are not even medical personnel. I know someone who is even working in a school. He is also addicted to the same substance. So it's not actually about no.
Loneliness and
whether you know about it or not. No, it's still about your genes that matters. And then the next one is the age you started using can be a factor for you to actually be addicted. So as I said, when you start using in your teenage, you know that for sure. Some people started drinking alcohol when they were 6 years. Yes.
That's a long time.
Yeah, when they were 6 years. So they were not drinking it, but they were tasting it. Maybe it was, my father was a palm wine tapper, and so when he gets, when we go and test it and see how...
Small bottle, we
yes,
realize the whole gallon.
Yeah, so that is how addiction begins. And then, as I said, if you're a male and a female, you are susceptible to it because you're a female, because of your fat deposit and then the guys too, they're more daring. They just want to see whatever they take a risk every time, and so they want to see whatever you're telling them to stop. They want to experiment it and see whether it will actually happen. Yes, and they need to belong. Peer pressure and all that, curiosity, need to belong and all that can also cause that kind of, that can predispose addiction.
Okay, so let's switch a bit. So let's say I'm an addict in the church, and then I feel it's a lot on me, so I want to talk to someone. What do you think can be my best approach? Is it that I come straight to my senior pastor, or I look around for, probably if we have like a nurse associate in the church or someone that can help? What do you think?
Okay. So I would say that seek medical advice or expertise. So let's say I'm in a church. Yes. So I'm a mental health professional, and that's what we do every time at work. And so I would gladly help if someone comes from my church and wants me to help. And it's not about being labeled or something. So we are professionals. Yes. So I can't say that you are an addict, and so when I meet you in church, I'll make sure that everybody knows that you're an addict and all that. Yes. So because Jesus is still healing, you can still talk to a pastor if you want to, but an additional professional help should be given. Yes, because pastors are also there to help. Some pastors are trained to become psychologists or counselors. Yes, and so they can also help. But let the professional ones also be attached whilst you, so we'll walk you through the recovery journey. So we say that anybody in addiction that wants to stop should be taken through the recovery process. So it's a whole process. It's not just one time, I've prayed for you, get up and go. No. No.
It takes time.
It takes time, and it takes a whole, it's a rehabilitation process. And for rehabilitation, you are restoring them to an optimum function. You are not actually taking the whole thing or making them whole as before. No. So they should function in the society in which they live.
So would you suggest that our churches should have maybe a session where they can invite people like this, like in your field, to just come and share briefly? And then I'm sure that would also help those who are dealing with this, because I feel sometimes people are not able to talk to our leaders because they believe when I share, I'll become the topic of discussion in their next preaching. So don't you think it's an open avenue where I think the leaders in the church could actually do that for as they...
Yes, so I think, so it's good that you are hosting this program, and I think that's the first step. And I see other departments in the church contacting me or something to come and give a talk on these kind of topics, but not addiction. Yes, maybe a mental health topic or something. And so we can maximize this whole topic and make it maybe one day in the church or at departments or something.
Just for mental talk.
Yes.
Mental health.
Or maybe just for addiction talks and all that, so that people can be enlightened on what to do next if they have that kind of issue.
So you've already established that it's not prayer alone that can solve addiction.
So I'm saying that Jesus is still in a miracle business, yes. And so anything can happen. However, Jesus didn't heal everyone when he was on earth. There were still people who were sick but didn't get an encounter with Jesus. And so in our present days, the same thing is happening. People can get miracles, and miracles do happen to people. But those who don't have the encounter, they should also seek, because God has given wisdom to so many people to handle these issues. Imagine me waking up early in the morning and going straight to work just because I have clients waiting for me, yes, to have sessions with. So, so it's a field that people should embrace. Yes, and stop seeing them as rather demonic and then seeing those with malaria and other things as normal sicknesses.
So addiction is like a whole health issue on
it's
its
a health
own.
issue. So see addiction as hypertension and diabetes. Yes, the way you cast out hypertension and diabetes, cast out addiction, yes, like that. So see it in the same thing because they are all chronic diseases. And for every chronic disease, we don't cure it. We manage it. Yeah. So for diabetes, we manage diabetes. We manage hypertension. So we should manage addiction too. Yeah.
Can someone be anointed? I'm not saying our pastors, but there are a lot of everyone in the church is anointed. So it's possible someone can be anointed and addicted at the same time.
So this is a very big question. It's a very big question. So I think yes. I think so. Yes, because some people can cover it up so well. Yes, they can cover it up so well. But as addiction is, addiction dwells in secrecy. So that's one of our slogans that we use in our therapy sessions. So addiction dwells in secrecy. Anything you keep hiding grows, especially if it's an addiction. Keep hiding it, it grows. But one day people will actually see it. Yeah, so some people can hide it and be. But how addiction is, I wonder how somebody will be addicted
and be able to function
and still be anointed at the same time. Because addiction is so anyone that is addicted is so selfish. And it takes so much of your time. So what time are you having with the Holy Spirit and at the same time the drug? So that's a question I keep asking myself. So if you are actually, if you are anointed, it means that you spend so much time with the Holy Spirit. And you spend so much time with the drugs at the same time. So it might be the levels. Maybe you are still at the level 2, or the second stage, or maybe the third stage of your addiction, but not actually addicted to it. But when you're addicted to something, it takes most of your time, and then you don't see anyone else except that substance. Yes, because it's so much intimate with you than any other thing. Yes.
So at that point, the anointing will turn to addiction. So the time you are supposed to be spending with the Holy Spirit has now turned to the time you are spending with the addiction.
Yes, and it might make your anointing come down. Maybe you are doing it with experience. You are not actually using the Spirit of the Lord. You are now doing it with experience. Yes, the experience you had in the previous days, you are now using the same experience now, but you are not actually having a renewal of the presence of the Holy Spirit.
I think more education should be carried on mental health and addictions, because I didn't know about the genetics aspect that it's more or less like hereditary too.
Yes.
So what can the long term, in terms of our brain, what can addiction do to our brain if we see it like in the long term? Because in the short term, if established, you might start being different, taking away your time, your money, but in the long term, when you talk about our mental health, like our brain, what does addiction?
So when we say someone is addicted to a substance, we are saying that there are marked changes in a person's brain. How do we see that? So we do scans. So we call it PET scan. So because you are not medical experts, I will not go into that. So we scan the brain. And when you scan the brain of a normal person and the person with addiction, you see so much marked changes. So let's say the activities in the normal person's brain, maybe the neurotransmitters, or maybe the chemical reaction in the normal person's brain is more than the person with addiction. Because now you're getting all your substances from outside, external. Now the natural ones in the brain are sleeping. So you can see that these ones, there are no much reactions in the brain because they are sleeping, and then these ones are working every time. In another sense, maybe to make it more understandable, breaking it down. So let's say the brain is wired to make you feel happy with nice meals, good dresses, maybe you got in a dress, ambience, you are in a relaxed environment, and you are having that kind of baby kind of treatment.
baby girl
treatment. And you're enjoying that kind of company. When you start smoking, you realize that those companies are nothing to you at all.
They don't interest you.
They don't interest you anymore because you're getting something from an external source. And so that external source takes over your brain and now gives you the pleasure that a normal nice meal, sweet meal can give you. Now it takes it away and you don't see those ones as important again. Yes. And so anytime you are supposed to get into the mood, you need something else.
Okay.
But at the beginning, the natural ones were actually working well for you.
But because there's been a switch
Where there's an external one. So the natural ones are now sleeping.
And then the external ones are
actively working. And so you need it every time to fill in the gap. Otherwise, you are not going to be happy. You are not going to function well as you used to do. So that is how it's seen. Yes.
So in the same way where I see good food, I'm happy coming to eat. When they see those external substances, that is where the excitement.
Yes, so the excitement goes to it. So we call something. So when we talk of addiction, we were talking about the definition of addiction. So we call something compulsion to use a drug. Okay. So whenever you say compulsion, there is an obsession with this. So what's obsession? So when you're obsessed with something, you are the Narcotic Anonymous call it. So it's a fellowship or it's a kind of society. Okay. So of men and women who have decided to stop using drugs, and then they have written their books and all those ones. And so they say that obsession is an overpowering desire. So let's say desire. So imagine a desire that is overpowering.
Desire
a more thing.
Not overpowering.
So obsession. So when you're obsessed with a drug, anybody that smokes or that uses that kind of substance is your friend. Like you love the person naturally.
Oh.
Wherever this thing is smoked, it's where you want to belong.
Okay.
You want to dress like anyone who smokes like that. You want to be in that kind of space every time. You are just attracted to it, and it comes to you every time. So your whole brain and attention is on that kind of substance. So whenever we say compulsion, it's more than just I admire this thing. No, it comes with a desire that pushes you to do something that you can't explain.
You say, why are you taking it?
Why are you taking it? That one you can't ask. When you ask, there's no answer.
There's no answer. Okay. So if I like food, I like eating, like every time I'm eating, it's like continuous. That one is not addiction.
So we are saying that we have bad behaviors and then
maybe
bad habits or something. Yes. So let's look at the consequences. Is it that it's making you fat? So fat that, or it's making you you are having diabetes and you are still not stopping. So we still look at the consequences.
Okay.
Of your action. So whatever you are eating, is it that you are being diagnosed of hypertension because of your meals and you are still not making any changes to it? That's where the addiction bit comes in. Yes. We also use the definition to, and there are other criteria that we use to measure
classify sometimes addiction.
Yes.
Okay. So definitely addiction has an effect on our identity, because the way people see you and then your self-esteem is like there's a whole lot of switch when you start being an addict.
Yes.
Okay.
So there are people who can do it so well.
They can hide it
so well. Yes, they might be up and everything, but they're still having so much struggles in their closets.
Okay. So maybe those sides you can push addiction in terms of the pornography, the gambling, those sides, because I feel those ones don't really show on the outside than the drug substance abuse.
So because it's addiction, so we say addiction is addiction no matter what it is. So if someone is having gambling addiction and then pornography addiction and substance use, you might see a link in it. Okay. So there's a link. So you can see that this person is always in a hurry to go somewhere. This person, so there are characteristics that we see that can show you that this is an addiction. So everybody is interested in talking to people, having time. This person in a hurry to go somewhere. Where is this person going? So anytime you want to know whether someone is getting addicted, so maybe you have a sister, a brother, someone at home, you want to know whether the person has started becoming addicted. So most we look at the functionality of the person. So how was this person at the beginning and how is this person now? You should see the signs so early. So we are saying that anytime we are able to arrest it at maybe the second stage, the person is not able to move to the fourth stage again. Yes. That's why early detection is key. So this person starts isolating and starts hiding things from people. So one client will tell me that the dress I use to smoke is different from the dress I bring home.
So he hides the other dress away.
Yeah, so he has a dress that he uses to smoke.
Okay.
And to pop pills and so much with his friends.
Okay.
And so he has a school bag. He puts it in it. He has spray in it. He has eye drops.
Okay, so that
he has lip gloss. So there's a kind of lip balm that is used for the lips. So you don't see whether the person is. So his fingernails are always being scrubbed. Anything to detect whether the person is smoking is not detected. Okay. But you still see that this person finds himself in a kind of a group of people.
Okay.
So even if you are telling me that you're not isolating in your room, you might be isolating from the rest of the world to a kind of a group of people
okay.
who are just smokers.
Okay. Well,
so when all your friends are smokers, then you should know that's what you are still isolating from the rest of the world.
Okay.
So it's still an isolation.
Okay.
So let's say you used to keep money so well. Now your money issues are down. Now your behavior is just different from the beginning. Now you are bold. We are not saying that people who are bold are smokers, but maybe you were shy at the beginning, and then all of a sudden you are saying that you can stand up to your mom, your dad. We are not saying to people who want to bully you or something, but to people you used to respect.
Okay.
Now you are so arrogant towards them. All of a sudden, you start asking questions. Start bringing them forward. Substance testing.
Okay, we have tests to
know. So we have tests to know whether somebody smokes, to know what kind of drug. So we do all those things at Overnotch.
Okay.
Yes, we do all those things there.
I think I'll be bringing a group of people.
Yes, we do all those things there. So we get your urine, and then you are there with us. So it's not that this is not my urine, this is not my no. So this is a direct observation.
Okay.
Yeah.
So it's not just needles. For some of us, we are
no needles, just urine.
Urine. Okay.
Just urine, and then you can see whatever the person smoked in the past 1 month or two.
The records will show.
Yes.
That would be quite interesting to do. Oh, okay.
The substances will show because nobody wants to be seen as an addict. Okay. Nobody wants anyone to know whether they are. That's what I always say, that addiction is so secretive. People want to do everything in their closets, so that no one sees it. And so sometimes you know that the person is smoking. The physical looks like that, but this person will still deny that I am not an addict. And the same one of the symptoms for addiction. You always deny that you have a problem. You will not admit that you have a problem. Yeah.
I think we should talk to our youth pastor. You carry all the youth and then go and do testing so we all see. Okay. So if we've gotten to the stage where I'm an addict, I've realized it's affecting me. So I want to recover. I want to change my ways. What would you say would be the appropriate measures or the appropriate path I should take?
Okay.
But please, I'm not an addict.
So as I said, addiction is a chronic disease. Okay. And because it's a chronic disease, you need a rehabilitation or therapy sessions. Okay. Yes. But the first thing we start is to do an assessment on you, ask you certain questions, and see whether you actually fall within the range. And then ask follow-up questions from people who live with you. Sometimes you might not see, most people who are addicted don't see what they are going through.
But those around,
they mostly don't see what they are going through. Yes, you are changing. You might see that you are changing, but you don't see how
you are changing.
Yes, except someone talks about it and all that. So we get reports from people who live with you and all that we can make a kind of conclusion or a diagnosis that yes, we are dealing with addiction. So when we eventually settle on this, then we start with the treatment. So there's a whole treatment protocol for people who are actually addicted. So yes, and then it comes to the stages. So if you are just at the second stage of addiction, maybe some counseling sessions will just help. But as I said, when you're on the fourth stage of addiction, we need to admit you, depending on the drug you use. So for alcohol, when you're actually addicted to alcohol, we admit, because alcohol, when you want to stop taking alcohol, as I said, you might go through some hallucinations, some seizures can come in, you might have temporary memory loss and all that. And so we admit you, give you some medications, some infusions to help you come out of your withdrawal symptoms. And then when you are now okay, we start with the counseling sessions and then other things. So there's a whole treatment protocol that we start with it. So it still starts with meeting the right person who will help me and who will take me out of this. And it's a process. It's not just a one-time thing.
Okay.
So relatives come and then they are just like, help my son, help my. So this son didn't become addicted in one day. We cannot use one day, just like malaria. So let's say malaria. You are just using 3 days to cure your malaria. No, addiction is a lifetime recovery process. It's a lifetime. It means that when we start seeing you now, but for maybe for hospital or something, for therapists, you might go for maybe 4 months, 6 months,
okay,
and then you are done. But we need to have your contacts and then make sure that you are still not going back to the addiction again.
So when you say we admit you, are you talking about the mental hospital admission, or there are separate places to handle?
So addiction is still a mental illness.
So you take the person to the mental hospital?
So for now, we have rehabilitation centers that deal with only addictions.
Okay.
And so, but most people who are addicted, the reason why they end up in the hospital is that it caused a mental illness.
Okay.
Because most times people will not actually mind an addict. Somebody who is always living with addiction, nobody will mind that kind of person until they start destroying things at home, start insulting, start causing chaos at home, and then now people will just bring them to the hospital. So that's what mostly happens. And so when they end up in the hospital, you might think they are mentally ill. No, it's because they are going through an episode, yes.
Okay. So most people that have the mental illness, some of them are as a result of addiction that has caused such an effect on them.
Yes. Okay. But now, some people don't even smoke at all. They are not even addicts at all, but they still have mental illnesses because of other reasons. Not related to addictions. Okay.
So if you say, how important is accountability when you are going through the recovery stage? Because I know, can there be situations where the client or the person, the addict, will lie that, oh, maybe I'm doing this, I'm doing that, but the person is not being honest. So how best can you ensure that the person is being accountable and the person is actually on the right path to recovery?
That's what, as I said, recovery is a process.
Okay.
And because it's a process, anything can happen.
Okay.
And it's a rehabilitation process. You want the person to function to be in their maximum function. And so you don't expect them to recover overnight. So it's true.
They can relapse and all.
They know that they can relapse, but there might be a kind of dishonesty along the way. Okay. But when they see that their abstinence is helping them, they sometimes come back. So I have this client that at the beginning will tell me that, I'm coming for session, I will not smoke today.
Why you smoke?
No, but when the person comes and then you check their urine, you realize that there is a substance in it, and you start asking about it, and they will now come out and tell you. So when they see whatever they are getting from the therapy sessions, most times they change. Yeah, but we are saying that it's a process. So the parents, the caregivers, the professionals should have patience for this client. They are doing their best. And then mind you, anyone who used to smoke for a whole day or was smoking every day and I stopped smoking for a whole month or 1 day, 2 days, it's a big deal for them. So you should appreciate that instead of saying that you are telling lies and all that. So stop looking at the lies and you are not even saying small, but whatever effort they are putting in, it should be acknowledged. Yes.
Okay. So right now, what would you say to someone that's battling with addiction, putting together everything that we've discussed, like the best advice you can give to someone battling with addiction right now?
So I would like to say that if you are addicted to any substance or any kind of behavior, you should seek professional help immediately. No matter the stage in which you have gotten to. See a professional. Talk about it. It's not going to be blown to the whole world. Nobody's going to hear about it because it's strictly what's confidential. Okay. Yes, nobody wants their dirty linens washed in public. And so speak to a professional. Let's arrest it there and then, so that it doesn't progress to the fourth stage where you need so many therapy sessions, admissions, rehabilitation centers, and all that. Yes.
Okay. And then if you also come to the church, what can you also see the church should do to help the youth that are battling with some of these addictions in the church?
Yes, so the church can do so much than any other person.
Okay.
Because I see that a lot of people come to the church with various battles. And so the church shouldn't be looking at only the spiritual part of developing a person. They should look at behavioral aspects too, things that can help the church. So whenever you want to break stigma, it starts from the church. When you want to break a kind of domestic violence, whatever, abuse, trauma and all that, it starts from the church, because whenever they come to the church, sometimes they might pretend, but when you're able to speak to them at the pulpit, they might listen. Most of them listen because they know that it's coming from the pulpit. And they're satisfied from the senior pastor. Yes, so things like this should start, programs like this should start coming up. Yes, so that we can get so much education and awareness creation on these topics. Yeah.
So, like I say, thank you very much. I strongly believe it's never too late to get help, whether it's professional help, whether it's help from the church. No matter what kind of addict you are, you can always seek help. If you are in our church, that's Living Waters, you can see Mrs. Mary Forson. She will gladly help you out of whatever addiction you are battling with. So we'd like to say thank you very much for being on our show today. And then we hope most of us, or most people that will be battling with such things or are battling with it, will seek medical help, and then we'll all be okay to give our best to society. So thank you once again.
You're welcome.
Thank you. So that is it for today's session on Vessels Club podcast. We will see you on our next episode, and don't forget to like, share, comment, and subscribe to our YouTube handle. Until we meet again, bye.